My name is Eric Powers. I am a professor of internal medicine. I'm a cardiologist. I am the director of the Acute Coronary Syndrome Center, and I'm also director of the Heart and Vascular Center. I went to medical school at Harvard Medical School. I did my training at the Massachusetts General Hospital in Boston. After training, I went to Columbia University in New York, where I worked for a while as director of the Cardiac Catheterization Laboratory. I then went to the University of Virginia in Charlottesville, where I stayed for 17 years, also as director of a cardiac catheterization laboratory. And then I came to MUSC. That makes my whole experience after training more than 20 years. When I was a medical student, I was looking for interesting things and what would interest me. And I came across a mentor who was interested in the function of the heart. He was a cardiologist. And then I began to work with him, and I worked with him for actually quite a long time, doing research as well as developing clinical skills. And really from that time on, I was committed to cardiology. I have done many things during my career in cardiology. I am what's called an interventional cardiologist. What that means is that I take care of patients who have heart attacks, take care of patients who may be having heart attacks in the near future, trying to prevent heart attacks. So the whole issue of damage to the heart through heart attacks is a major focus of interest. Other areas are the function of the heart, an illness called congestive heart failure, which is a very common, very important problem, but also interest in other parts of cardiology as well, including diseases of heart valves. My treatment philosophy is that in 2008, in the modern era, there is lots and lots of technology and lots of opportunities to do tests to make diagnoses in patients with heart disease, and lots of opportunities for treatment as well. So my philosophy is to try to match all of these opportunities for tests and treatment to the individual patient, to find exactly the right tests and the right treatments. It's easy to do too much testing and too much treatment. It's also easy to do too little. So the challenge is to find just the right match for each individual patient. MUSC is an organization which has experts in almost every area of medical care, certainly in every area of heart and vascular disease, so that for any heart and vascular problem, whether it is a small one, whether it's prevention, whether it's a major heart attack, whether it's a heart transplant even, we have the experts here who can care for those kinds of patients. So I would like people to know that we can take care of any cardiovascular problems they have. I'd also like them to know that access is a very important issue, and the patients can have access to our experts. We're ready and prepared to take care of them. About myself, I love taking care of patients. I like helping people, and I enjoy new patients. And I'm busy clinically, and I'm happy to see patients almost any time. We obviously live here in the Charleston area. We love the Charleston area. We love the beach. I play golf when I can, as well as I can, which is not always very good. I have a 9-year-old son. We spend time doing all the things that dads and 9-year-olds do, which is kind of how I spend most of my free time.
For more information about this physician or services at the Medical University of South Carolina, call 1-888-792-4990 or go to muschealth.com.